Good morning, and thank you for the opportunity to present my proposed research project. My name is Dr. Godwin Mwisomba, and I'm a child and adolescent psychiatrist at the Mirembe National Mental Health Hospital in Tanzania. I recently completed my master's degree in child and adolescent mental health at the University of Northampton in the United Kingdom. So today I would like to present my proposed project titled Smart MH Tanzania, Scaling Mental Health Access Through Referral Technology, Task Sharing for Children and Adolescents in Tanzania. So this project basically seeks to address one of the most important, pressing but neglected public health challenges in Tanzania, which is lack of access to mental health care for children and adolescents. So throughout my career at Mirembe National Mental Health Hospital, I witnessed firsthand enormous challenges faced by children and most families seeking mental health care. So many children traveled hundreds of kilometers to reach specialized services, and some families cannot afford transportation. So others even delay seeking care because of stigma, lack of awareness, or simply because services are unavailable in their communities. So by the time children arrive at the hospital, their symptoms have already affected their education, social development, family relationships, and overall well-being. So at the same time, we are seeing an increasing number of young people experiencing depression, anxiety, substance use problem, trauma, and emotional and behavioral related difficulties. So despite these growing needs, Tanzania has very few child and adolescent mental health specialists. So this treatment gap is not unique, to Tanzania. It reflects the broader challenge across low and middle income countries. So the question that really drives this project is simple. How can we bring mental health care closer to children instead of expecting children to come to mental health care? And scaling mental health access through referral technology and task sharing, the name itself, is built on three principles. The first one is actually democratizing mental health knowledge by empowering communities with skills that are needed to identify and support children experiencing mental health difficulties and problems. And the second one is decentralizing services from specialist hospitals into schools and communities. And the third one is using technology to connect community-based workers with specialist mental health support. Instead of relying solely on psychiatrists and psychologists, Smart MH leverages existing community system to expand access to care. So why community healthcare workers and teachers? This is one of the greatest strengths Tanzania's mental health system has, and the network of community health workers and schools is the base of it. And these are trusted members of their communities, and sometimes teachers interact with children every day and are often the first to notice emotional and behavioral challenges. Yet these people are not utilized enough in child and adolescent mental health care. So Smart MH aims to change this by providing training, supervision, and digital tools where community health workers and teachers can play an important role in early identification, support, and referral of children experiencing mental health difficulties. So this approach is known as task sharing and has shown promising results in many low resource settings. So the primary objective of the Smart MH is to evaluate whether a digital and task-shifted mental health system can improve access to child and adolescent mental health care in Tanzania. So specifically, the project seeks to improve early identification of mental health problems, increase referrals and engagement with care, improve mental health outcomes among children and adolescents, strengthening community and school-based support system, but also to generate evidence on like how such interventions can be implemented and sustained in real-world settings. So the design in which SmartMH will be conducted will be the hybrid type 1 effectiveness implementation study. So this means that we will primarily evaluate whether the interventions work while simultaneously examining how it can be implemented successfully. And the project will use implementation science frameworks, including RE-AIM and CFIR, where children and adolescents will be screened using culturally adapted tools, digital tools delivered through a mobile platform. And the screening domains will include depression, anxiety, emotional and behavioral difficulties, trauma, exposure and psychological distress, and psychosocial functioning. Results will be reviewed by mental health specialists who will provide triage and referral recommendations. And children identified as needing support will receive evidence-informed interventions delivered by trained community health care workers and teachers under specialist supervision. So these interventions will include parental coaching, psychoeducation, behavioral management strategies, problem-solving interventions, trauma-informed care approaches, and also referral coordination. More severe cases will be referred to specialized mental health services. So this model allows specialist expertise to reach many more children than would be possible through traditional hospital-based services alone. Expected impact out of this, like if successfully implemented, SmartMH could have significant impacts at multiple levels. For instance, for children and families, it could improve access to timely mental health care. For schools and community, it could increase mental health literacy and reduce stigma. For healthcare system, it could demonstrate a scalable and sustainable models for expanding child mental health care services using existing resources. And also for policymakers, it could provide evidence to support national mental health reforms and integration of child and mental health care into primary health care and educational systems. Importantly, the project has potential to serve across Tanzania and Sub-Saharan Africa. So the SNF Global Center for Fellowship represent an extraordinary opportunity to strengthen my skills in implementation science, digital mental health, healthcare system research, and research leadership. So this fellowship would provide mentorship, training, and international collaboration needed to successfully implement SmartMH and generate high-quality evidence capable of influencing policy and practice. So it would support capacity building within Tanzania by strengthening local expertise in child and adolescent mental health research and implementation science. My long-term vision is a future where mental health care is accessible not only in hospitals, but also in schools, homes, and communities. I believe that every child deserves an opportunity to receive timely and effective mental health care, regardless of where they live or their family's economic circumstances. So SmartMH Tanzania is like an important step towards achieving that vision. And by combining community empowerment, task sharing, digital innovation, and implementation science, this project seeks to bring mental health care closer to the children and families who need it the most. So thank you very much for your time and consideration. I look forward to the opportunity to contribute to the mission of the SNF Global Center and to advancing child and adolescent mental health in Tanzania and beyond.